Our next speaker is Michael Kelly. Michael Kelly has been a member of the Atlantic Clubhouse in Quincy for over 15 years. In addition, he is a proud member of the Massachusetts Clubhouse Coalition and the Consumer Advisory Council. More recently, Mike was appointed to the South Suburban Site Citizen Board, where he is actively championing the Community Conversations Initiative. When he is not busy advocating for himself and others, he enjoys reading mystery novels and studying the Bible. Please welcome Michael Kelly. We would like to acknowledge Representative Luke Hafta and Representative Paul McMurdy.
Thank you. Hi, my name is Mike Kelly. I'm a client of the Department of Mental Health. I'm just happy to be here today at the People's Home. And, had an eventful ride in, had a good tour of the city. It was very nice. I enjoyed that. And I have received DMH support for about 30 years with diagnosis of schizophrenia, anxiety, depression, alcoholism, and diabetes, to name a few. What I have learned is that these diagnoses are not who I am. They are challenges I have to overcome. DMH services such as case management, clubhouse, and community-based flexible support, CBFS, have been invaluable and instrumental in my recovery. I had felt like a victim in the past, especially detesting being called Mikey, which made me feel like a child. As I felt stigmatized by others, I realized I was stigmatizing myself. As I saw myself as a crazy person being defined by my own mental illness. However, I began to recover about 20 years ago as I tried to change, but the process was a long and difficult one. Finally, it was about 10 to 15 years ago, the sobriety took hold, and I felt like I had a spiritual bypass when my faith became spiritual anchor. I became involved with the recovery learning community, the Clubhouse, and Dual Recovery Anonymous, continuing case management support, psychotherapy, and taking medications helped me cope with my past and strive toward my recovery goals. I know I've had my share of ups and downs, and when I was in denial of my mental health, ready a minute.
Here we go. Wait a minute. Here we go. Okay.
Without support from, challenges, I could be arrogant and obnoxious. However, I was always motivated by the need to keep going forward so that the ups and downs became less frequent. Recently, I was overcome with frustration and anger at the news of suicides and tragedies in the news. I was particularly touched by Robin Williams' passing and felt an overwhelming need to share my story with others in the hope that others would do likewise. I want to channel my frustration toward prevention and feel that I must do something to change things. I am working with South Suburban Site Board's Community Conversations Initiative, championed by DMH, and will share my story with any groups who are willing to listen. It is important that we spread the hope that recovery is possible and can be achieved with the support such as what DMH provides. Without support from legislatures in this great State House, services such as case management, the Clubhouse, CBFS, Consumer Advisory Council, and Partnership would not have been available to me throughout my recovery. I hope you will continue to support my and others in recovery. Thank you very much.